A stroke and a TIA both occur when blood flow to the brain is disrupted, but the key difference lies in the duration and severity of that disruption. A stroke happens when the blood supply is blocked long enough to cause permanent brain damage. This can occur through a blood clot obstructing an artery or a blood vessel bursting inside the brain. In contrast, a TIA, short for transient ischemic attack, causes only temporary interruption of blood flow. The blockage clears on its own, and the symptoms resolve within minutes. Because TIAs leave no lasting damage, many people underestimate them or fail to seek help. However, TIAs are not harmless. They are urgent warning signs that the brain is struggling with poor circulation, unstable plaque, or clot formation. Stroke symptoms that appear and vanish should never be ignored. Understanding the basic difference between these two conditions is the foundation for recognizing when immediate medical attention is needed. One of the clearest ways to distinguish between a stroke and a TIA is the duration of symptoms. In a stroke, symptoms persist for more than 24 hours and often much longer, reflecting permanent damage to brain tissue. A person may continue to experience weakness, speech difficulty, paralysis, or cognitive impairment long after the initial event. In contrast, TIA symptoms typically last only a few minutes and rarely exceed 1 hour. This happens because the blockage in a TIA resolves quickly, restoring blood flow before significant brain damage can occur. Although the symptoms disappear, the event itself should not be dismissed. TIAs are often described as warning strokes because they mimic real stroke symptoms but do not leave lasting injury. However, they indicate that a major stroke could happen soon. By paying attention to symptom duration, individuals and healthcare providers can differentiate between a stroke requiring immediate emergency intervention and a TIA that also demands urgent evaluation to prevent a future stroke. The most significant difference between a stroke and a TIA is the impact on brain tissue. During a stroke, the prolonged lack of blood flow deprives brain cells of oxygen and nutrients, causing them to die. This leads to permanent neurological deficits depending on which brain region is affected. For example, a stroke in the area controlling language may cause lifelong speech difficulties, while a stroke in the motor cortex can lead to paralysis or weakness. In contrast, a TIA does not leave lasting damage because blood supply returns quickly. The brain cells are stressed but do not die, allowing full recovery once blood flow is restored. This is why TIA symptoms disappear completely. However, the absence of permanent damage makes TIAs deceptively dangerous. People may ignore them or fail to report them, missing a crucial opportunity to prevent a major stroke. Understanding the distinction between permanent brain injury and temporary disruption is central to recognizing the seriousness of both conditions. Strokes and TIAs share similar underlying causes, but the severity and outcome depend on how long the blood vessel remains blocked. Ischemic strokes, the most common type, are usually caused by blood clots forming in the arteries due to plaque buildup, high cholesterol, or damage from high blood pressure. Clots may also originate in the heart, especially in patients with atrial fibrillation, and travel to the brain. Hemorrhagic strokes occur when weakened blood vessels rupture and bleed into the brain. TIAs are typically caused by the same mechanisms, especially small clots or tiny pieces of plaque that briefly obstruct blood flow before dissolving or moving on. The key difference is that TIAs involve short-lived blockages, while strokes involve prolonged ones. Understanding these shared causes helps highlight why a TIA is not a harmless event. It signals that the conditions causing the temporary blockage are still present and may soon lead to a full stroke if not addressed promptly. Both stroke and TIA share the same warning signs because both involve disrupted blood flow to the brain. These signs include facial drooping, arm weakness, speech difficulty, sudden numbness, trouble walking, vision changes, and severe headache. The fast rule face, arms, speech, time applies to both conditions. The difference lies not in the symptoms themselves, but in how long they last. TIA symptoms resolve quickly, often within minutes, while stroke symptoms persist and may worsen. Unfortunately, the brief nature of TIA symptoms often leads people to ignore them, thinking the issue has resolved. However, Even a short-lived symptom is a serious clue that something is wrong with the brain's blood supply. Recognizing these shared signs and acting quickly is critical for both stroke and TIA. Regardless of duration, any appearance of these symptoms should prompt immediate emergency evaluation. Although TIAs do not cause permanent damage, they are among the strongest predictors of a future stroke. A TIA indicates that the blood vessels in the brain are unstable and vulnerable to blockages. Studies show that the risk of having a major stroke after a TIA is extremely high, especially in the first 48 hours. Up to 1/3 of people who experience a TIA will have a stroke within the next year. TIAs should therefore be treated with the same urgency as strokes. They offer a brief window of opportunity to diagnose the underlying problem, whether it is uncontrolled blood pressure, atrial fibrillation, high cholesterol, or unstable plaque, and begin preventive treatment. Ignoring a TIA means missing the chance to intervene before a devastating stroke occurs. Understanding why TIAs are medically urgent helps individuals take appropriate action instead of dismissing temporary symptoms. Diagnosing a stroke often involves imaging tests such as CT scans or MRI scans to determine whether the brain has been permanently damaged and to identify the location of the blockage or bleeding. Additional tests may include blood work, echocardiograms, and carotid ultrasounds to determine the cause. For TIAs, diagnosis can be more challenging because symptoms usually disappear before medical professionals evaluate the patient. In these cases, imaging may show no visible brain damage, but it still helps identify narrowed arteries or risk factors. Doctors rely heavily on the patient's description of symptoms, the duration, and medical history to diagnose a TIA. The absence of permanent damage does not mean the event was harmless. Proper diagnosis is crucial for guiding treatment to prevent future strokes. Understanding the differences in diagnosing stroke versus TIA emphasizes why seeking immediate medical care is essential, even if symptoms fade. Treatment for stroke often involves emergency interventions as to restore blood flow or control bleeding. For ischemic stroke, clot-dissolving medication or mechanical thrombectomy may be used. Hemorrhagic stroke treatment focuses on lowering blood pressure, stopping bleeding, and sometimes surgery. In contrast, TIA treatment focuses on prevention. Since TIAs do not cause permanent damage, the goal is to prevent a full stroke by addressing underlying risk factors. This may include prescribing blood thinners, controlling blood pressure, lowering cholesterol, treating atrial fibrillation, or recommending lifestyle changes such as quitting smoking and improving diet. Both stroke and TIA require urgent evaluation, but the long-term management differs. Understanding these treatment differences reinforces the importance of seeking help even after symptoms disappear. Prevention after a TIA is critical because it offers a second chance, an opportunity to address the underlying causes before a full stroke occurs. Lifestyle modifications, such as adopting a heart-healthy diet, exercising regularly, limiting alcohol, and quitting smoking are essential steps. Medical treatment may include managing diabetes, controlling blood pressure, and taking medications such as antiplatelets or anticoagulants. Regular checkups help monitor risk factors, while imaging tests can track artery health. Understanding that a TIA is not simply a minor event, but a major warning transforms prevention efforts into life-saving actions. Early intervention after a TIA significantly lowers the chance of experiencing a debilitating stroke. The difference between a stroke and a TIA may seem simple. One causes permanent damage, and the other does not, but the implications are profound. A TIA is not a harmless episode. It is the brain's cry for help and a direct warning that a major stroke may be approaching. Recognizing this difference empowers individuals and families to take quick, decisive action. Whether symptoms last minutes or hours, they should never be ignored. Understanding stroke versus TIA, learning the FAST rule, and responding immediately can save lives, protect brain function, and prevent lifelong disability. Awareness is the first step toward prevention and early treatment.